the name
My name
plates.
right there, right?
I don't
I think we can
tell you the truth, Terry. I don't know.
Yep.
we can probably fit three. Right, Colby?
There we go.
Yeah, I was gonna say.
I mean, and we could put 3 chairs. Where's Chris? Yeah, come on, Chris, down, Patrick. I'm just going to give everyone a couple more minutes to come in. Do I need to summon them? I feel bad. Dr. Stamp and Colby are speaking out there. And Dr. Oates. Carrie. Dr. Oates on something.
Usually pretty punctual. It's usually me that's.
He said everyone
He
was
was-
going to be here.
Oh, you know, like kids didn't have school.
See, ours too.
I know.
I just got back last night.
There's,
You always just right in my time.
I'm telling
and then my daughter's.
Good for you.
Well, and they had.
I mean, yeah. My son had. Did you like it there?
And I had to
I've been going for 12 years.
Oh, really?
like
Yeah, it's so nice.
So then he had game.
Do you stay in the same place?
You,
Oldest didn't it?
no.
I
I
know a
do,
lot of
but
And then
I
I
don't go.
consider
My husband is an athlete.
brought.
Oh,
My children are his friends, but
I'm in the car.
kind of gave him
Until 4:20.
Oh, they.
So.
Oh, nice.
Yes.
So then my son
Yes,
on my way to see.
Yeah.
the wonderful games.
Yes.
Get her
I didn't do a good job of
bought
getting it.
free.
Very good.
Cancer treatment, so I dropped it.
I'm gonna give him 2 more minutes.
This is stupid.
I feel like it's like so honestly the time that we coordinate things that are so going through sometimes it's
Which is our
ridiculous.
teacher.
I ordered
You got the
stuff.
email.
Yeah.
Give us a heads up.
You? Yeah. Did I say you did?
Yeah.
No, you would only tell me if you did.
Ski to
I hope so. I hope to.
That
okay.
I texted I did.
Yeah.
Okay.
Just so you know.
Makes
I
sense to
wanted
me.
to say you're missing out. I'm like, I don't know.
You know, makes sense to me at this point in life.
What's up, 4:30? Did you see the email? Like,
Makes
go there a
complete-
second.
That's how awake I am.
I
I
yeah.
I sat down in the chair by
Running in.
2:30 and
How about you?
I got up at 4 and I slept most of that night, but I'm still.
And they let me in, like me.
I don't know if they've been fed,
Yeah.
but I figure at this point,
Well, I'm on
But, like-
muscle relax. You know how.
critical
Yeah,
thinking
I-
skills is have to.
Like, blah, blah.
I'll probably keep my mouth shut tonight.
Cooking dinner, and I wish it were you.
This is what I was wondering. What are the hot
I have my meeting.
So they can take them
Yeah, fair enough.
out with
Fair enough.
whatever? Okay.
Don't
That was
miss
they're new.
our
Gotcha.
Yes.
Do you?
That was my only question.
That's just one. Mute my phone.
I had quite a few
capacity.
things, emails.
All right, well, I gave him 5 minutes.
Yeah.
It's okay if we start. All right, let's go ahead and stand, please, for the pledge. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, I thank everyone for joining us on this election day. I hope you all exercised your right to vote today. Thank you for joining us. We are waiting for Dr. Osan. I think he's supposed to join us, so we'll just go ahead and start. Dave, unfortunately, is not with us again this month. He is on medical leave. He is very stir crazy and waiting to get cleared to get back, right? So he asked if anyone has any questions or concerns to just please reach out to him. He sounds great. I've spoken to him a few times over the course of the last couple weeks, but he's basically stuck at home going stir crazy right now. And we're thankful to have Colby back with us again. And I have to thank you. I know a lot has been thrown on you in the last few weeks, and I know I've reached out with a lot of questions, and Carrie's worked with you, and I thank you for being so right on the ball, and just, there's no delay in anything, and everything has been moving as it should. We have a full agenda today. If we can have a motion to approve our minutes from the last meeting.
I move to approve the minutes.
Second.
Second?
Dr. Boxham,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Kathy,
Yes.
Terry.
Yes.
Thank you.
Thank you. Our next board meeting is scheduled for June 4th. It's crazy how fast time is flying. And now, under new business, we have several new exciting proposals coming our way for review. First up would be Purdue Extension. Yes, if you could, please, up for, yep. I should have said that, I'm sorry.
That's okay.
Thank you for joining us.
I haven't been to a health department meeting.
No?
Yeah, but I've been to the county council, so I know how that works.
Very good.
I'm Annetta Jones. I am a Purdue Extension educator here in Porter County. My teaching specialty is health and human sciences. And so with the proposal that I submitted, I was wanting to assist in our health and wellness here in Porter County, and by providing programs that are beneficial for our health and wellness. So I talked with Carrie and Dr. Stamp. Some of the programs that thought that would fit within the chronic disease area would be programs such as Be Heart Smart, Med instead of meds, and this program really encourages Mediterranean eating and eating a diet following the Mediterranean diet style. And cancer prevention, lifestyle, plant-based eating are some of those programs. And as we know, 2/3 of our chronic illnesses are really related to diet and lifestyle choices. And so this is what those kinds of programs really work towards addressing. But, you know, choosing that fast and fried and processed food is really at the unhealthy end of the diet. Most of our programs in Extension are trying to get us into the My Plate style of eating. And then even with our chronic illness and our Mediterranean diet and cancer prevention, we're really trying to go even beyond that by highlighting cooking from scratch. So cooking is the other part of diet and nutrition. And so along with these programs, we're going to be teaching some cooking skills and nutrition, as well as nutrition, because people, even though they often know what they should do, they fail at trying to put all that information together and finding time to really shop and prepare those foods. So we really want to work on helping people feel more comfortable and feel confident that they can create a healthy meal from what's on the shelf, or when they go to the store, make choices so that their pantry is full of healthy foods. So again, I just brought some flyers from our program. So this is our Be Heart Smart. And so it talks about know your numbers. It talks about heart healthy cooking. We always try to have a demonstration so that people can taste those foods that we're suggesting so they feel more confident. This is our flyer for Mediterranean diets. Just lifestyle changes for cancer prevention. This is very near and dear to my heart because I've already been through cancer twice, and I have a friend that's going through it, so this is one that I've really tried to implement myself. Some of the other things that in the proposal, not only do we need money for foods to demonstrate with, but also then some supporting equipment. So I brought some examples. And so like measuring cups, ways to clean foods. And then we have these neat new opportunities for cooking or for cutting boards. And then it has some food safety information on the back. So, and then in the area of fall prevention, we have a program called Matter of Balance that really helps to our older population assess their community or their homes so that they know, what kind of hazards might lead to a fall, as well as helping them to do some strength-based training, as well as exercises that will help that. And so with that proposal, I included the cost of being trained as a master trainer, the cost of, again, more supportive equipment such as, lights that will motion censored, tub adhesives, and then like the traction tape that you put on steps, just some things that would be assisting with that. So those are the programs, those are the explanation of costs, and if you have any questions.
If you could maybe give us an idea of how you see this being implemented into the community specifically, like where are we going to implement these programs?
So with Matter of Balance, I'll start there, but with Matter of Balance, I would make the offer to all the senior centers after winter or after the summer parks programs are done, we can offer it there at Sunset Hill as well. Plus, then there's a community room at Portage. So I'm going to try to find different locations throughout the county that we could offer that. I am hopeful that we can offer it at least 4 times during the end, till the end of the year. It is an 8-session program, so it does take quite a bit of organizing and scheduling. So that's my hope for that. And it is limited to 12 people in a class. So,
And it's free then?
so there is a cost of $25. My request is that for those people that are unable to pay that $25, that the proposal money would actually cover that for them if necessary. For the,
I'm sorry, that
well, and then the wellness
12 people go through an 8-week
at a time.
at a time.
At a time. Yeah, that's
Do you
just,
have multiple sites going at once, or you just do like?
well, my hope is that I could do like a morning session
Okay.
and then an afternoon session and kind of do 2 at a time
Uh-huh,
in order to get all of them in,
okay.
before the end of the year. That's my hope. So we'll see.
So you're thinking Portage, Sunset Hill,
Portage.
the senior center?
Right.
Okay.
Yeah, Chesterton, I've worked with Story Point before, so maybe Banta or, one of the senior sites.
So you've done these programs before? Or
I have not
or-
taught this particular one. I've been trained, but I haven't taught this one. The way that it's set up right now, we have to have a master trainer as well as an additional trainer. And so by me becoming a master trainer, I would be able to train additional people within the community instead of having to call in our local educators. So the nearest person that's trained right now is in Marshall County. And so that would mean I have to pay them mileage to do that. And so I can get around it by being trained myself.
Good.
So
And where do you get trained?
I've been trained to present and assist someone, but I haven't been trained to be a master trainer to train someone else.
Okay.
So there are 2 levels of training. So, I mean, I can do it now, and I can call someone else, but they're doing the matter balance, so their schedules are tight. So it would just be harder to get it scheduled and get it all those details worked out. Could be done, but
So what's your future, what's the long-term goals for this program? Just,
so the long-term goals are to reduce falls in the community and to help people have a better core balance as well as feel more confident in their homes or in their surroundings so that they are not, as susceptible to falling and tripping.
do you have any testimonies from any of these people that did the program already?
I don't have them with me, but I know that Linda has been doing the program in Lake County for a long time, and it's very popular. We've had some calls for the program here. 2 different people have called and asked if we have it scheduled, and so I haven't scheduled it yet, so this would be an opportunity for us to do that.
Excuse me. So, how do you, for your target audience, right? So we're talking mostly seniors, right? Our 65 and better patients, or whomever. How are they notified of this program? How do you get the word out to them?
So we'll use social media, news releases. The Senior Times is another popular publication that we can use, radio.
Okay.
So we have a variety.
Okay, good.
Plus, we work with some groups that have senior audiences as well within our office. So we would market to them also.
Okay. Good. Thank you.
Mhm.
And where are these cooking classes taking place?
So some of the same places. Again, I have access to Sunset Hill. I've got a good relationship with the Parks Department, but so that would be one location. We have different communities, places in Portage that we could go to, as well as the libraries would be other places that we could work with and that I have worked with. So I think that they won't be too difficult. I don't have a specific location that I wouldn't go to. Churches, faith-based locations would be options as well.
Are people able to reach out to you to ask for a program
Absolutely.
at their location?
Sure.
And is this another or is this just one time?
So
Or is it?
for Be Heart Smart,
Huh?
that's a 4-session program. That's the way it's set up for us to present it.
How many folks could be?
That's unlimited.
That's unlimited.
The rest of the programs, only this one Matter of Balance has a limit of 12. Those are the restrictions that the training organization puts on it. So as far as a Mediterranean diet or meds, that one is unlimited. It would just be a matter of the facility and really, and how many we want to have space for, really. And then cancer prevention, that's really a 2-session program right now, so that's a little shorter. We can do the meds instead of meds 1 session at a time, but it really covers the different food groups, protein, sweets, grains. So that's usually an overall program you want to try to teach in all 7 sessions, but we do have one overview program that can be used as a 1 session. So that kind of an introduction. What else did I miss?
And this, I would imagine, is more broad spectrum in terms of the age groups and families, maybe young people.
Right, yeah.
Could be open to.
Yeah. Another location, I talked to Hilltop also, and
Soup
so
Kitchen.
we have plans to work together also, using some of the programs.
For me, programs are exciting because they hit several of our key performance indices and our chronic health matters that we'd like to address that we really haven't been able to do so until we got our new funding. And so I love how this, fall and injury prevention, chronic health, healthy lifestyle, there's so many checks that I can check off in terms of the things that we'd like to offer to the community that, to me, this is an exciting prospect.
I had about 4 patients that would have used some direction on this today.
Right.
And it's not only just guiding them, if they can't afford arrange physical therapy, it gets them out. And that is the core to keeping them happy, strong, independent, staying at home opposed to, so it's just another valuable tool. It's just making sure I'm aware of it. And like you said, sharing, and we're right next door to Story Point. So we have so many new ECF facilities out by us. So we try to use that as a fulcrum to get people involved out together. And
Well, and it also helps with connectedness.
Yes,
Because
yes.
when you get those people together, it really, they begin to talk and they establish some new friendships and things. And I think that's,
community.
yeah. Mhm. And as well as with all of them. I mean, that's part of the process of being excited and learning that is accentuated in these programs. So.
And when would you propose that you would be able to start the diet programs? You said for the fall prevention programs, that would be.
Well, the next training that I'd be able to take would be in June.
Okay.
So you have to sign up by the 1st of the month, and then the training is at the end of the month. But if the proposal goes through, I would go ahead and get that scheduled and begin getting classes started right away. Because since I have been trained, I could, whether or not I went through the training, I could work to get someone else to assist with it so that I can go ahead and get that training done. So then for the foods programs, it's, again, we can, as soon as we can get them scheduled, we can begin to present. So that's real, and we have to have a little time to get people signed up.
Sure.
Right.
Get those things.
Logistics.
Yeah.
Yeah.
I also appreciate another avenue for us to make connections with our community partners. This is a new community partner, and this is something I know the state would like us to do too, and so I think that's an exciting prospect to have a partnership with Purdue Extension, I think is wonderful.
Another thing I didn't mention as far as partnerships is that I've worked with Christy Cleveland at the Y, and she works with community health. And so we've talked about doing Mediterranean cooking together. So, that's another opportunity
Collaboration.
to work together.
Very good.
So.
Very good.
Thank you.
Well, thank you. If anyone would like to entertain the motion to approve the contract with Purdue Extensions for Heart Healthy Diet and Fall Risk Prevention programs.
Motion to approve.
I'll second.
Okay. Dr. Bossom,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Kathy,
Yes.
Terry,
Yes.
thank you.
Thank you. And we look forward to hearing back. We want those updates. We want to know how many people we've reached. We want to know the impact that this has made. So we look forward to working together. Thank you. All right, so our next proposal is from the Respite Marine and Alice Halfway Houses.
Sign me up.
Yeah. What good time?
The fall prevention.
My cardiologist will be so
Very good.
My fridge is full of hummus. Hello.
Hello, sir.
This has got to be better than the last time I was here, a couple weeks ago. Okay, so the proposal's pretty straightforward, but I think you probably, because I don't think I've ever been here, give you a little overview of what we're doing in substance abuse treatment in Porter County. You know, I submitted this on behalf of all of the halfway houses because we all struggle financially and we all face the same hurdles and the same burdens. But what we do, we provide residential treatment, Moraine House and Respite House for men, as well as Alice's House for women, for people suffering from substance use disorder. But it's not just a place to sleep. We provide programming, life skills, etc. And they're required to go to self-help meetings. They get to choose what avenue of recovery they pick. Is up to them, but they have to pick something. And they have to either have a recovery coach, a peer recovery coach, which has become popular, or they have to have a sponsor. So that's kind of how this rolls out. And in conjunction with this, you know, there's little offshoots like the Unity Cafe, and now Respite House now is the proud owner of New Creations, because we're building a homeless shelter that's going to replace the need to rotate through the churches. So we're in that process. We're expecting to break ground any time. The funding is in place. I talked to the mayor today. The city, we have multiple partners on that, for interns to do case management, the churches to continue their volunteer missions, cooking. The new homeless shelter, just to give you a little heads up, here's what it's going to look like. I designed it for 48. The city said 24 was more than enough. So the primary shelter will be 24 people with 4 live-in staff, and that will have showers, 2 floors, but the bottom floor for handicap, bunk rooms, showers, lockers, etc., an office, and that will be staffed by the live-in staff as well as by a director. Then there will be a resource center for all day with a full commercial kitchen. I'm getting really good at designing kitchens, walk-in fridge and freezer, you know, commercial dishwasher, commercial stove with the hood, the whole bit. So that's going to be really nice. I'm excited to see the kitchen. But it'll hold about 60. It'll have side rooms for case management programming. We're going to gather all the demographics and data on these people. We're going to find out what services they've had, what services they need. Part of staying there in the primary shelter and to participate, we want them to engage in services. We want them getting their recovery services. It doesn't mean we're going to kick them out if they test positive on an alcohol test for the homeless shelter. Now that I'm differentiating from the recovery environment because they're 2 different things. But we're gonna direct them to different avenues of help. It's gonna be right across the street from Recovery Connection. So that kind of works. North Shore's involved, HealthLink, Porter Stark, etc. They're gonna, if they need mental health treatment, they're going to have to get it, engage. And they're going to have to take their medications. My side job between all this is an attorney. One of my jobs is I do the mental health commitment hearings in Porter County. And I'm also on the mental health restoration court. The biggest problem I see in mental health commitments is the failure of individuals to take their medications because they believe that the medications have an adverse impact. I don't know what it is, but everyone. So that's where we're at. And the more serious mental illness, I think they call it, I know they call it, the more seriously mentally ill they are, the less they want to treat. And so it's just, and then so wrapped up into all of this homelessness is substance use disorder and mental illness. The comorbidity is unbelievable. And, you know, and there just aren't enough treatment facilities in. So we're going to focus on all of that. Then for in the inclement or hot weather or cold, there's going to be a warming center. It'll hold about 20. It's got some side rooms. Now, these two, the Resource Center and the Warming Center, I'm talking fast because I don't want to keep you. I could talk about this all night. No. They are co-ed, so that's men, women. The warming center, cooling center, will also take women with children. Now, the goal is to relocate them into more stable housing. So we've also partnered with the other housing places as well. Now, wrapping all that back around to why we're here. So that's what we're doing in the community. Moraine House has a substance use disorder treatment facility, residential, same type of programming. In fact, I stole my programming from them. I'm not gonna lie. I looked around the state and picked little bits and pieces, and that's how we put Respite House together in 2009. So, but part of our programming is drug testing, understandably. And I know there's some questions that punitive in nature, what's the purpose of that? First of all, not everyone who tests positive is put out. When they come into the program, they're tested, you know. But it's a protective measure because here's what substance use disorder treatment looks like. It's support, for sure, programming, a place to sleep, a place to eat, and a place to get clean. But it's also accountability. You can't recover if you're not willing to be accountable, and this is part of the accountability piece. Many of our people are court ordered. It's part of their court programming. Many of our people, some of them, a lot of them come from treatment. And so drug testing is an integral part of the treatment process. It's part of the accountability, it's part of the support, because also you've got one person out of 25 in a house. You know, you've got the other 24 that you have to protect as well. Plus, the courts have sent them there as a protective measure for the community. So this drug testing is an integral part of what we do. So that's why we feel it's important. It's one piece. It's kind of in the big picture thing, it's kind of, I'd rather you buy us our food for a year, but it's kind of or pay our NIPSCO bill. It's kind of a small piece, but you know, it's integral to what we're doing, and I think it's an important piece, and it's a piece that you could easily help with if you so desire.
And this is a service that you've been providing up until this
Oh,
point?
yeah, and we're gonna
Where was the
continue.
funding up until this point?
Well, here's the thing. We all get our funding from various places. It's difficult. None of us, for instance, we get Recovery Works funding.
We don't.
But they don't. Alice's doesn't. We do. It's getting more and more difficult to get it. You know, we're going through a file audit now, and then they're gonna come inspect the houses, and if you complain, Homeland Security comes and inspects you, I found out. So, yeah, it's
The
really,
majority of our funding is from the residents themselves. They pay rent.
or it's.
So that's how you've been able to fund this amount?
Yes.
Until this point? There hasn't been grants or anybody?
We have some grants, but most grants now are for brick and mortar repairs. Like we no longer get a grant for our counseling services or any of these kinds of things. Like we're actually pretty tight on funding at Moraine House right now.
Years ago, the hub, or
Right.
that was called the Substance Abuse Council, I believe, used to provide funding, but they're problematic.
So did you say you're projecting to do drug testing for people who are seeking shelter at the homeless shelter as well?
I can wrap back around to that.
Because I'm
yes.
just wondering if.
We're starting, now that we have taken over New Creation, there's a new sheriff in town. We have a little different view on, you know, not that they weren't doing a good job, because trust me, they were, but we're doing more active drug testing currently.
So what's your sort of your prediction of the number of tests based
It's
on
gonna
what
go
you
up.
previously had done? Do you have a number of
No,
tests you've done in
no.
that? No? Because I'm
I
wondering.
could have asked, I mean, I know.
Well, I mean, I would imagine the request is a certain amount based on what you're going to do at Great Lakes Lab, so I would.
Right.
There would
I
have to
mean,
be
that,
that you're
the
working.
numbers may be on the invoice. I didn't bring the invoices, I'm sorry.
Oh, that's okay.
The numbers of, I brought the letter and your requirements. I think we clearly fall within the requirements, so
How about the opioid settlement money that's out there? Would that not?
they did.
No.
Yeah,
I mean, my issue is, I'm gonna be honest with you, I cannot negate the need for this, and everything that you're saying is correct. My difficulty is in understanding if this falls under our purview, and if this is the proper use of our funding, going forward. So I can't, what you're saying is all correct, I personally, at this point, don't understand how that falls under the health department and our funding should be covering.
Well, and I don't know, I'm looking at your funding mandates, trauma and injury,
Because when
harm reduction,
certainly, and we try to reach the most amount of people that we can reach with the programs that we're implementing. So, this
Well,
is a struggle for.
respite households, 25 in the new one, and 16, 15, let's say, in the old one, so 40. And then Moraine households, 16?
Yeah, we're at 14 now after some new, like, rezoning and those kinds of things.
And then Alice's is about.
And I did go to attend as many opiate settlement meetings.
I mean, I just feel like that's the perfect.
Yeah, but they did not want to allocate dollars towards existing houses. They wanted to create new programs in the community, and most of it went to the care coordinator that's at PACT and.
That was
or
the
sheriffs.
city,
Yeah.
at the
And then
city.
for the sheriffs.
And the county, I can't remember what we did, but.
Yeah,
I
so
was on
I have
that
tried that. I thought that was a good resource too. I really didn't think that was too much to ask for to assist with this, but.
And there are no grants, you say, for this.
Not for this, no. And I think the idea was too that this was, paying for drug testing for all the 4 different houses, so it was kind of taking something off of each houses, like helping each house like a little bit in
Because
their costs.
the reality is, all of our costs have gone up as well. Food costs, our utility costs, so even the grants that we do get, they don't go up. They don't move. So,
How many residents at Alice's house?
probably 15,
they're
I'd
at-
say. What do you think?
Yeah, I think they're at 15 as well.
I want to say 15.
And so if these people are coming from, they're in recovery and they have court appointments and things to meet, why doesn't that system cover the costs of the testing? Is that ever part of it?
Most of ours are not court ordered to be there. They choose of their own volition to get treatment.
Or the partnerships you have with HealthLink or North Shore that you mentioned, why can't it be done through that as well?
They don't give us money. They bring their van like you guys take your vans. They do testing. They help them get signed up for insurance, but they're not going to.
Is that testing that they could offer through their vans or things of that nature?
No.
This is required by the houses and the courts.
Yeah.
So the courts require you,
If they require that, if they ask for a drug test, they pay for it.
they do pay for it.
They pay for theirs
For the court.
if they
But not
ask for a
ours.
drug test.
And we require it because it's for the safety of all of our
Oh,
residents.
that part, I fully concur. It's just for me to,
Understand why that's not paid for by someone else.
yes, are we the proper place to fund this?
Not sure.
I'm not sure.
That's your decision.
So on your proposal, I think it had down for funding for this year and next year.
Yeah, I put 2 years. I didn't.
So I'm assuming you'd be still willing to maybe take it just for the year and then.
Oh,
assess
absolutely.
If you have.
We can
somebody
find
even
out
puts it forth, maybe even, giving them the half the amount to see if, it actually makes a difference. I think it would be like, I'd have to look at the.
Well, the total request was about 14,000.
Right, so it would be
seven.
7. But I mean, that way, because we don't even know what next year brings with, our funding and whatnot as well. So I mean, possibility that we could, if, we get,
I guess
bring it up.
my issue doesn't change
Yeah.
in terms of, is this how we're supposed to use our?
And I think the 13 or 14 was 1 year.
Oh,
I think I was looking for
that's what I was gonna ask.
double that. If you look at the invoices, because I got a year
The
invoice
14 would only be for 2000, it would be from
this year,
this year.
or a year period from now till
Gotcha.
next
Which that's how
May 1.
thing. And
Yeah.
one year count.
And what's the outcome data? Like, what's the expectation for the funding? Is this just funding drug testing, or is there some measurement to show the,
I could tell you how many
outcome.
tested positive or negative at the end of the year. I mean,
I can tell you how many graduates we have
Yeah,
every
how
year.
many
I mean, I can
graduates?
give you
Yeah, I
lots
do
of
too.
different-
I like that
I guess,
better.
if you're going to invest in something, especially in treatment and improving mental health and reducing drug use and substance use disorders, then we want to see some measurable outcome.
and it is difficult.
Investment, yeah.
It's difficult to measure.
Measure, isn't it?
You have to understand, if these people could be there a whole year and next week be dead of an overdose after they leave. If they go back to where they came from, they go back where they were. And they're, and they're very susceptible to overdose and death. And that's a real story and a real funeral that I went to. I mean, the success stories, I get texts constantly. Hey, I just celebrated 2 years clean. Hey, it's my 8th year clean. Or, I mean, there's lots of success and that, so I guess it's kind of like being a doctor. You get kind of immune to it. You do the best you can, you hope for the best, you give the best programming, and,
Well, yeah, if we're trying to improve, the quality of life for all the residents of Porter County, having people using substances less, engaging in unsafe behavior less, is helpful for everyone in the community, right? Reduces crime, reduces
I believe it.
those kinds of things. And so I think when I look at this proposal, that's what I think, like you said, investment in each individual, but investment in the safety and security of the people of Porter County, and how do we have, what's the outcome?
Yeah, and for us, the outcome,
Yeah.
we celebrate every graduate. I mean, for us, it's buy a cake and, you get something really, really hard.
We do as well.
Yeah.
And, you talk about that, the sheriff would tell you that 90% of the people in the jail have a substance use disorder that are locked up. So that's the reality. Almost all of our crime is substance use disorder related, whether it's theft, battery, drug cases. Any other?
Mitch, thank you for coming.
Wouldn't have missed it. I thought I was going to have post-traumatic stress disorder. And I was told to do not resuscitate, but I survived.
Oh, you did it. Yeah. Good job. And I'm sorry, I don't remember your name.
Mary.
Mary, I saw you at one of the opioid settlement
Yes.
funding
Yes.
meetings
I tried
with councilmen.
If anyone knows anyone.
Just
that's
getting
to add
your roof fixed, I think that would.
halfway houses, that would be awesome.
Yeah. I think we need to. I think we need to have a big fundraiser in Central Park or something to support all the. I don't know. We need to do. Yeah, fundraisers. We need to help support you in the work, the hard
Yeah.
work
necessary.
that you do and that your residents are doing. They are doing really hard work.
And we appreciate that. And, the biggest, because we do a fundraiser every year, and here's the thing, if you don't have a beer garden or
I know.
fest or Margaritaville or whatever, people don't come.
Right. Yeah. They're not looking for cucumber spritzers and lemonade, are they?
Not looking for music and Valpo Velvet.
Right.
Oh, but that's what we got.
Partner
That's
with
the dog.
dog shelters. I think those people are all
Like animal.
our animal lovers are. Yeah, I think that would be a good partner.
So I thank you for your time.
Mitch, I have a question though.
Yes.
What has been your experience with Great Lakes Labs in terms of, well, their service and their pricing and how that works? Because I'm sure there are potentially other options out there with the occupational medicine clinics that do a lot of drug testing and.
There may be, but the problem is Great Lakes is always there. Take it right over if it's an emergency. They're local. We all use them. I don't know, it's like from day one we've used them. And I knew Doc Capeless, and I know Shelley, and I mean, I don't know.
Yeah, customer service is a lot.
They're always there for us. If we need something, if we have a question about, we're not catching this, what do? We call them up, they give us a special strip that tells us, oh, what is it, Kratom? Kratom.
Kratom.
This one's on Kratom. So, I mean, it's a moving target with all of these designer drugs and, it's a moving target getting us. So it's nice to have that ability to communicate. Whether it's the cheapest or not, maybe not. But, it's a local business. It's kind of like I like to go eat at Mediterranean. And because it's a local business. So you
Understood.
You
Yeah.
could be correct, though. I have no doubt. But I'm not going to tell my ex-wife that. She's going to go to Great Lakes Lab.
All right. Good.
I mean, I don't want to speak for everyone, but if anyone wants a motion to approve, I'm personally not ready for that at this time. But if anyone wants to present that motion,
Well, I think
then we will take it under advisement, and I want to look, more into funding options and definitely champion for you to get
thank you.
more awareness. All right, so next up on our agenda is the Porter County Council of Aging.
Good evening.
Good evening. Thank you for joining us.
Thank you for the opportunity to come and to share our proposal tonight. My name is Jason Kegabine, and I have the privilege to be the new executive director of Porter County Aging and Community Services. And this is Judy Paracki, who is our deputy director. And we are here to seek additional funding to help support our transportation services. We recently just had 3 buses that had to have 3 brand new engines placed into them, so our ridership was down. We've also had some struggles since COVID, the pandemic, with some staffing. So since then, we've got all of our buses back up and running, and we are now almost to a place where we are trying to get fully staffed. But as you know, with the inflation and the mechanics and all that has gone up, that has caused us to seek some other funding sources. And because of that, our community members, there are some unmet needs that we have not been able to meet due to the funding as well as the busing and the mechanics are being down. But we are coming back with a vengeance, and we are trying to do our best to meet needs. So we are asking for an additional 2 salaries, which is about $80,000 for 2 drivers, and that will help us to meet some unmet needs when it comes to taking our clients to dialysis, to cancer treatments, St. Agnes, going to the banks and to the grocery stores. Right now, 40% of our riderships is dialysis patients, 10% is cancer treatments, 20% is St. Agnes, and then the rest of the 30% is banking and groceries and just minor other errands that we're running. These 2 additional staff members would allow us to provide about 10 to 12 rides extras per driver, so that's about 22 riders for the day, and that comes out to about 110 riders for the week.
Wow.
Which then, at the end of the month, which would be about 440 to 450 riders for the month there. For the month of April, we served 1,394 clients. So with the additional 450, that would take us up to closer to the 2,000 mark where we're serving individuals for those needs there. Our frontline staff, which are the ones who go to the doors and picks up our individuals, takes those to those necessary appointments for their treatments, are very vital. Not only do they provide the transportation, but they provide that companionship. They provide the extra support that they need of getting their groceries on and off the bus to their front doors. So there's a lot of added benefits to that. We are in need right now of replacing 4 of our buses, but that's going to cost an additional $115,000, which we do not have at the moment. So that's a conversation with NERC, but we are able to replace 2 buses at this time. So we're on the docket right now of getting 2 of our buses to replaced out, and those have very, very high mileages on that, which are causing our buses to be more off the road and into the mechanics. So therefore, that's, again, not meeting the needs of our riders. Also, we've had some riders that have reached out to us, especially some of our VA veterans that needed to get to Lake County, but because of the parameters and the limitations, we are looking at other avenues of getting those individuals to the VA or to St. Mary's Medical Center or to the Franciscan in Michigan City so that they can receive the necessary services that they need as well. So at this point, we're just seeking $80,000 to provide 2 additional drivers to help fully staff our team, as well as to provide the additional 500, up to 500 riders that we can provide in our services.
I did just want to make one comment really quick, and I know Carrie will definitely concur with this, but the service that they provide with the door to bus, bus to door, you can't find that anywhere else.
No.
So that's something that we can't get with the Lyft business or, anything else we're doing, all the looking that we're doing. So I just wanted to, I'm sure you guys realize that, but point that out that it's.
Yes, all of our buses are ADA compliant, so that means they all have a lift. There's also access to the stairs as well, but our driver will actually get off the bus and help them from their front door onto our bus safely, and then when they get to their destination, they will get out of the bus and help them off the bus and get them to the front door. If they're dialysis, most of them are in wheelchairs, so they actually will roll them into the facility and check them in there. And then the same thing with the St. Agnes folks who are suffering from Alzheimer's and dementia. They'll make sure that they get into the locked facility and make sure that they are accounted for there as well. So yes, we are door-to-door services.
So when I saw this proposal, I was excited and had a lot of questions at the same time. I think I borderline harassed Carrie with my questions. One of the concerns, I think this is fantastic, but I just it makes me nervous of being in charge of somebody's salary. Like, we're aware that this is a year-to-year contract. Is that something that you're comfortable with if this were to go through, that we will reevaluate this every year? And, it makes me nervous that someone's salary is based on that.
So we get funding every year through NERC as well. So that helps to do some preventative maintenance as well as operational, which covers some salaries. We also get funding every year from the County Commissioner's Office as well. So that helps to provide some funding with that. We are also seeking grants as well to help offset some of our other expenses so that we can allocate the funding for our transportation service. But 75% of what Porter County Aging does is transportation services. So that's number one priority. So if that is becoming in jeopardy, then our other programs would be the first on the docket to start being eliminated first. So that transportation services will not be in jeopardy or be affected by that. Also, NERC also gives us funding based on our riderships as well. So if we can increase our ridership, we can also increase our funding from NERC. So they already see our challenges, why our buses are down. They can't argue with that because they get all the invoices every month that we have to send them for that. They also understand that our roster, we have to submit that, so they see that that's low. We've lost some of our drivers because they didn't feel comfortable coming back. We also lost drivers because we weren't offering a competitive wage. This will help us to provide some competitive wage and provide some extra fringe benefits such as the 3% match for a 401k, also some PTO and sick time, and United Healthcare life insurance policy there as well. So there's a couple of extra things that we can help boost that up. So to answer your question, transportation would not be affected in the long run. We would look at our other programs and evaluate those.
And how many buses do you guys actually have in service at the moment?
Right now, we have 11 buses, but 10 are in service.
Okay, and if we provide you with the salaries, would you guys be able to accommodate with the buses? With you saying you are having issues with your bus?
Correct. Yes, we would. So right now, we have our staff work 4 10-hour days. There's a rotating schedule there. So when there's a bus that's sitting stagnant right now because we don't have a driver to fill it, this new driver that we would hire, the 2 additionals, they would actually take that bus and be able to utilize that and start busing that every day and serving our clients. And then we are in the docket right now. Hopefully in June, we should be receiving, there's a bus sale that's going to be coming up that we've been invited to so that we can hopefully switch out these bad buses and get some newer ones and accommodate our riderships.
And Jason, these buses take people to locations all around Porter County?
Correct, all of Porter County. So we go all the way down to Hebron, Outs area. We service Portage, Chesterton, Valparaiso.
What about these appointments that you mentioned outside of Porter County? We can't
Cannot
service those?
At this time, we cannot service because that would be outside of Porter County. Now, NERC doesn't have a requirement because they're for the region. So that would be more of a county conversation I would need to have. No. But I'm also in conversations about getting a rescue vehicle, and that rescue vehicle would then be able to go beyond just Porter County. So that would be reserved for primarily our veterans and those that need to go to those 3 locations that are outside of our county.
Michigan City as well? Does that pull in Michigan City?
Michigan City, that's,
LaPorte County.
yeah, but that's outside of our,
Yes, it is.
I thought it does.
That's LaPorte County.
LaPorte County.
A
Yeah.
border exchange system. Drive.
Yeah.
Yeah. Yeah. And what is the schedule for the bus?
So the first bus starts at 7 a.m. in the morning.
Okay.
And the last bus comes in about 4:30. So it's really 7 to 5.
7 to 5?
Yes, Monday through Friday.
Monday through Friday, okay.
And routinely, I'll have many patients waiting.
Yeah.
Or that
Oh, yeah.
the office appointment needs to be rescheduled,
Mm-hmm.
and then they can't reschedule to get a
Yep.
bus on time. So I see that routinely.
I'm sure you're aware we did a county needs assessment in the fall, and one of the top 1 or 2 was transportation. And so I think we've been racking our brains to try to figure out ways that we can help contribute to the community. And everything seemed kind of, in terms of this, out of our realm. This is actually a very exciting prospect that seems like something that we can do. And I mean, just minimally, you're talking about 400 to 500 rides a month to start with. And I know a lot of the council persons they've been talking to us about helping. We've had a commissioner who's reached out and such. So to me, this seems like a fantastic partnership and something that hopefully can be doable. I know you had talked about, Carrie, moving some things around in our budget in terms of where like the transportation money that we're using is. Can you speak to that?
Yes. Yeah, so when we had identified transportation, and of course, put in our pie in the sky budget, we had originally allocated, it was a lot of money to put in different places. And so we were able to take some monies that we had in the lift and the bicycle program, and then kind of look at what in all reality we're going to be doing this year in those programs, and then say, oh yes, then that we easily have enough money to fund this proposal, as well as the bike program and our lift program as well for this year. So we were able to, we had to submit a revised budget once we kind of got in the space, got proposals, got the partnerships, and started working together. And it was really kind of then easy to see how we were actually going to be using the money and it was going to line out. So that's the state budget. It doesn't change anything about the budget that we approved. It's just they have, you have to call everything out specifically as it is and budget everything down to the penny. It was a different budget than what we do for the county and kind of how we lay out those projects. So
But we do have this amount allocated in the transportation line.
Under
Yes.
that.
And how we then divvy it out.
Yes. And that would qualify, obviously,
Yeah.
with
Yeah.
providing them with salaries for 2 people, is what
Yeah.
you're saying.
Yeah. Yeah.
Yeah. And
Jason, I have a question. Do you keep track of demand, meaning the number of requests that you need to turn away because you don't have capacity to carry them as riders?
Yes, so that is required by NERC. I do not have those numbers on me, but that is by chance when we get a triannual review. So we have a biannual, then a triannual. So we can be selected for an audit, and those numbers are required. And I can get those figures for you. But I can tell you that there was at 75, at one point, there was 75 that were denied on my desk at one point because we didn't have the drivers and because our buses were down.
Over a period of?
That was for a month.
For a month.
For a month. So you can probably see that when I started in December, Bruce was still there as the executive director. So that was December, January, February. I officially took over in March. So 75, I'm trying to remember the numbers. I would probably say it was pretty consistent every month, 75, 75, 75 in that area.
Okay, yeah, because I understand that those kind of numbers, I mean, word spreads, right? So if you're turning down a lot of people, demand will drop because they're going to assume that
There's
there's
no availability.
no
Right.
availability. So I understand that those numbers are not, but not necessarily truly reflective of what demand could be.
Right.
But for if this is approved by the board, that can be really helpful for us to know, like, are the funds from the health department in making a dent? Are we helping? What's the, what demand going forward, even over and above what we're providing, could be that those kind of numbers could be helpful for us.
Yeah.
yeah, because I would want to know, outcome data for the investment that we're making,
Absolutely.
right? Like you said, rejected versus fulfilled. And if we're seeing that gap,
I think we would need that.
yeah, if
to
we're
help
right,
out in
to continue to
future,
help at that level,
proposals,
because
I guess.
if we're bridging the gap between the number of people who've been declined rides
Right.
in the past and now the number of people we're able to provide rides, that's really exciting, and that meets that transportation need that the need assessment showed us.
Yeah.
Right?
Yeah, and I do a monthly report, so those numbers would be able to be figured pretty quickly for you all, so that we can even say,
Quarterly report
Yeah,
or
yeah.
biannual report, that would be.
And also, like you were saying, Dr. Stamp, to sort of get the word out again, because I think as Dr. Fleming was saying, I think in our patient population, we sort of get the thing, well, don't call them because they're not available. But now, if this is going to be relaunched, like you said, sort of get the word out that transportation is now available so that your numbers could be up and that you could show the need that's really there, that we hear, that we know.
right.
People are scrambling to find families and friends and neighbors to drive them.
Missing appointments.
Yeah, exactly.
Yep.
When if yours was available, they would surely take it. Yeah.
Since we've got all of our buses back, we did get, last month, we were able to get 45 new registrants.
Oh.
So waiting for now rides going forward. So we are starting to see some turn. Did go to, my marketing and resource development person went to the Triad meeting, and they had some good feedback that they're starting to see some friendlier faces and some rides are now being there. So I think this would help us tremendously to change the trajectory of our transportation services for those needs, so.
I think that this is exciting in terms of so many of our core things that we have to follow. A lot of these things are going to take a lot of time to make,
Yeah.
right? Like obesity numbers or diabetes numbers or cancer reductions. We're going to have to wait a long time sometimes to see those generational changes. But with this, it's kind of exciting that we can see really quickly return of investment, and I find that exciting.
Yeah, and when I see the high percentage of, when we look at the percentage of the attribution of death was in the dementia, right? And when we think about 20% of your rides are going to St. Agnes, which is the adult day center.
Correct.
I mean, that is really a positive thing, I think, because those folks are getting out there, they're getting, better integrated into those groups. And so, I mean, I think that directly impacts even maybe reducing, I would hope, the number of possible deaths, or at least, allowing those people to have a better quality of life
Right.
for a longer amount of time.
Right. Absolutely.
Yeah.
So I guess my question would be, how is the best way to word this? Because is this just going to cover staffing costs, or are we making this a proposal to cover staffing costs for 2 extra additional employees, or is this part of your general fund, or how?
Should
It would not be-
probably be a little more inclusive.
Inclusive,
based
the general,
Year by year.
yeah.
An
So how do you want them
adjustment.
to?
It would not be our general fund,
Okay.
because if it was in our general fund, that would be funding all of our programs. We would
Okay.
be able to tap into that for all the programs. So if we could,
Funding for transportation services.
correct.
We need to specify that it's salary.
Well, we could define it as transportation operational expenses. That way, it can help with salaries. It can also help with if we had maintenance costs, anything to keep the transportation department running, up and running. If we get some money from NERC for operational, and that's what it covers. NERC also does, just specific, like, this is just for maintenance on your bus, so we can't use that funding for anything else.
We get the same type of parameters.
Right,
So-
so operational would give us, and if you just designate it to the transportation department, operational fund, then we have the liberty for salaries, anything pertaining to keep our buses fully staffed, running, and any extras. If we do get the rescue,
Yeah,
where
exciting.
we can go out of the county for those services for our vets. I think that's a really good program. We have a lot of calls for that. And that would be something I personally would really like to see happen.
I agree.
The rides to St. Mary's,
I'm sure.
we have denied so many rides to St. Mary's, Franciscan,
For our veterans.
and to the VA, because that's where their services are. They are Porter County
We
resident.
can't help that, yeah, sure.
Yeah.
Okay.
We actually did try a few years back to coordinate with Lake County Transportation. And we tried to meet them at the county line and transfer clients. And that was a mess. Because, we have our scheduled rides that have to be picked up, and then they would be late, or, they couldn't wait if we got stuck by to coordinate.
Can barely coordinate my 3 kids pickup.
So,
Big fact.
we tried that for a couple months, and it was very frustrating,
Sure.
and we just couldn't do that. So it would really be awesome if we could just be able to get a rescue vehicle, get those clients to those 3 places.
And Carrie, that wording would fall under our purview in terms of how we would get this approved.
Yeah, we would have to work together once it came time for how we were gonna handle it, whether it was an agreement or a contract on how but I think with being another
Their county.
yeah,
Yeah.
that's helpful because
So transportation
I
operation.
followed one of your vans into my, our parking lot at the office this morning. I appreciate it, and I appreciated that they didn't drive 10 miles an hour. So, I mean, this is every day for us. It just helps people get the care.
Yes.
If we can't, that last 2 that I was telling you about, they needed to do a televisit because the husband just had a permanent pacemaker, and he's the driver, but he's just too weak, and his wife, my patient as well, is legally blind. So maybe we could, and then if maybe a Mediterranean dinner in there. This is all day long. So
This is real life.
I
This is real life.
appreciated last discussion, but this one, I see what you're trying to explain is a little more focused.
day to day.
Purview.
And I do
Yeah.
think it's important to try, if we are to pass this, to try and get it moving sooner than later. Because
Oh,
like I
yes.
said, We're
Yeah.
already,
Yeah,
It's May.
I know.
I know, it's crazy.
Yeah.
I mean, I'm
I
just throwing
say
it
we-
out there. in case
I
you don't
agree
get
with
it.
you. Yeah, no, I have a senior in high school. All right, so if we can, if everyone is agreeable, entertain a motion to approve additional funding proposal for transportational operational expenses for the Porter County Aging and Community Services Council.
I'll make a motion.
I'll second it.
Okay. Dr. Moxley,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Kathy,
Yes.
Terry,
Yes.
Thank you. I was
Thank
so
you all.
excited that this would work.
Thanks.
Thank you for all that you do. Yeah.
Yeah, and if you can give us that information, you just have it,
We'd like to brag about it.
Yeah.
And we'd like to put it on our find help.
Yes,
Right?
yes, yeah.
Exactly.
Thank you.
Thank you.
Thank you. All right, so our last new business proposal is the hardship request from the town of Porter. They didn't,
see anyone, the town of Porter here.
did you want to wait till the next time, or did you want to have a discussion? I will leave it open. You've been working hard on all of these proposals, so.
Yeah, did everybody get a chance to review it? Did anybody have any questions? Dr. Stanford for I know we're without.
Question. One of the discussions I've had with Carrie, when we got this new funding, one of the things that we approved was a hardship fund, right? That these things occur, and I know you guys use these for smaller things like the vital statistics if people need birth certificates or things like that. So the question came to create a kind of sort of criteria list of how we, when people come to us requesting funding from our hardship fund, you know, how we go about getting to the point of where it comes to us, right? And so I know you've been working on that, so that's something we can discuss in the meantime too, right?
Yeah, so that is something that, so historically, and Dr. Stamp, you can help me, before me, I believe years ago there was a hardship fund. And then it would get to the point where if it wasn't used, then more money would go into there. It would just kind of accrue.
Yeah.
This is based on what Dan's told me. So without him being here, I'm recounting on that. And then I think as things got tighter, that was of course something that we weren't able to budget for.
I think it was before my time too.
Okay.
So when we went, and we've actually been talking about it for a couple of years, just because we know that some of these situations in which, you know, somebody might have a failing septic system, and if they don't have the money to do a repair or to put in a new system or to hook on to sewer, they have very little their option sometimes could be that they can't live there, you know, that the home would be uninhabitable. And then other situations such as this one, you know, could come up as well. And so Dan has been talking about wanting to have this hardship fund for a while. And so when Health First Indiana came, it actually was, you know, a great time, and it is actually something that other counties have looked at and said, yes, wow, can we do that, you know, and are contacting us to adopt. So we have quite a large amount of money on the environmental side, $50,000 appropriated, and then $10,000, no, not that much, I apologize. Like maybe $5,000 on the nursing and vital record side. And we had started to write an SOP knowing that we were going to need to put something in place because some of these items could be very expensive. Mm-hmm. So unfortunately for us, that is not something that we had seen through to the finish and, you know, completely finalized at the time before this request came up, but it is something that had been in the works. And basically it just says that there has to be a need proven, and so individuals that come requesting it would be asked to, you know, show that it was a financial need. You know, they didn't regularly, you know, have the money to do the repair or the cleanup or
it's a public health risk.
Well, yes. So first and foremost, yes, the situation would have to be a public health risk, and then would have to prove financial need and inability to get a loan, for example, to get the money. And
did they explore the options?
So this situation, if I understand it,
yes.
If I'm understanding it correctly, though, is a little bit different because the home is in foreclosure, right? If someone was living in the home, it would definitely fall under our purview of not being fit for human habitation. That is true, absolutely. But there is no longer anyone in the home, and the home has been foreclosed on. The town of Porter gets involved because it is a townhome. So it has an adjoining wall and someone living on the other side. My understanding is the bank with whom it's in foreclosure is, or with which it's in foreclosure, has no inclination whatsoever of cleaning it up. They want to sell it and show it as is.
Even though it's been sealed by us, correct?
Yes, however, once the home is not inhabited,
Yeah.
our job is done. So there is no more, like, we don't say you can't go in there,
Okay.
right? That's not part of what the health department
You just can't live
does.
in there.
You can't live in there. So there is a little bit of gray area here. It really does need to be taken care of. I don't know, was the town of Porter able to put any money toward it? I can't remember offhand.
Yeah, the proposal had.
It was a
said that-
long proposal. I didn't
Very
it all out.
Yeah.
Yeah, I mean,
Yes, they had said, so they would have to go into, I believe they had some funds set aside. There was an email and a discretion, potentially they have to go into a discretionary fund. So they just basically were saying that anything that we could do to help out would be appreciated. Then, in the long term, the bank then would sell this, get a profit, then are we reimbursed?
This was my question.
Because I mean, my
We could
concern
put a
is
lien.
to put money into a residence, to bring it back up to code so that it could be sold. And then the bank profits from that? I don't feel comfortable.
Right, so being cleaned up is also not necessarily being
I've been harassing you.
remodeled for sale, those kind of things. It means that it's no longer a
A
human
human
health
risk.
hazard, right? So, so they are, the cost involved is a little bit different. You're right, the bank is trying to recoup some losses, maybe, or I suppose they could even be making a profit. I have no idea what
There
they're.
are multiple liens on the mortgage, yeah.
But, because I had asked about the leaning situation with Colby and Carrie, and as of what we got, the amount of liens still don't equal what they think the value of the home is. But I had asked you if we can put a lien, or if we can be participated in the lien, or if the city, and so
If you'd like me to comment.
I do, yeah, 'cause I'm out of my knowledge base there.
Generally speaking, you're gonna have, if you have a foreclosure proceeding, you gotta have somebody willing to overbid you, which is actually what creates the incentive from the bank not to fix up the home, because they just are gonna go in there and they're gonna bid probably the amount of their first lien. If you have a lower priority lien, or including the health department, anything that we would put up there would be behind the primary mortgage. You're not going to put money up to try to outbid them so that you can get some portion of your lien back and capture the profit. It's not, even though it does look like there would be some amount of equity basically in the house. You could sell it ultimately if it captured the entirety of that. It's very unlikely you would ever get anything outside of the primary mortgage. That's probably what the bid would be, and anything lower than the primary mortgage at foreclosure wouldn't do anything to it. Would just extinguish whatever lien you put up against the property. Basically, most of these houses too, if they require a significant amount of cleanup, people take that into consideration too. If it was a standalone house, I mean, this is a townhouse. It shares a wall with somebody else, and it's being done. Plus you never know exactly when this foreclosure is going to take place. There's a lot of different opportunities for people to delay a foreclosure. In the height of 2007, after we had a significant amount of foreclosures, and there was across the country, some of these were up to 2.5 years before you actually can complete a foreclosure proceeding. There's credit counseling that would be required before you can actually complete that under any circumstances, even if you're waiving that, even if you have somebody that's in some, so there's just.
And we would have to pay for an attorney to fight for this.
You'd have to
so we'd have
perfect
to
the
have
lien.
somebody there,
There's perfect and filing the lien. There's entering an appearance on the foreclosure so that you're even informed of when it's going. And then there's attending those kind of things. There'd be fees involved ultimately in trying to enforce a lien for what I would call probably, a 1 in a million shot that you get anything out of it. I mean, it definitely is something that you can throw up the lien and then
So that's the
ignore it.
explanation that I
Yeah.
was
Yeah.
searching for.
And I feel like that's a slippery slope at this point, to be getting ourselves into
Me too.
funding any of these
It's just how the presentation that she made, though, that made me think of that, like, we're doing their work for them, and then they can.
Well, if somebody was living there, it'd be one thing, but it's a
It-
vacant.
It's really now we're involved because of this person next
On the
door,
other side of
who's
the
now
wall.
being affected by the status of this home in the state that it's in.
Well, I mean, I feel like that happens anytime you're, living next to a foreclosed home, and it's been,
Yeah.
Yeah.
left
It's
unkept.
just, these are like a
I know.
shared wall. Like if you're an apartment, like we were talking, someone could be evicted or kicked out, but they're individual owners, so that poor person on the other side really has no.
Oh, yeah, I'm not saying it's not
Yeah,
like an
no.
unfortunate situation.
Yeah.
I
It's just-
wouldn't want to be living next door either.
No.
But, I mean, I guess that's one of the risks you take in,
Home ownership.
yeah, and in living in a townhome where you have somebody living next, in that close of a proximity.
And we were thinking of, if we were to get ourselves involved in these types of hardship cases, to cap our involvement at 10,000. Is that correct?
That was one of the things that we were considering in the
Yes.
SFP. We just hadn't.
I think that's,
Well, and how many would, because you said 50,000 is the.
Yeah.
So really, we'd be able to help 5 people a year.
and I think, we're reasonable people. We'd be open to discussions if there was something that was a huge septic situation or so, where we would listen. But I think that's a nice guideline to put out there, because the other concern I have is, what about the next case like this?
Sure.
I'm sure there's more than one.
Oh,
And so we can't fix them all.
no.
And so,
But do we also have the responsibility if there's someone living there? I mean, I think it's different, right? There's no, like, if it were a septic issue and a family was still trying to occupy the residence, right? There's no one occupying this residence. It almost appears as if they're just pushing the cost off onto us,
to help the
help
person next door.
the person next door. So, I mean, like you said, Robin,
I mean,
I feel for them.
yeah, I'm not saying it's
but I
not an
know
unfortunate situation.
It's our responsibility.
I think it might have helped to have, Dan obviously
Yeah.
couldn't be here tonight. That's understandable, and it really would have been helpful to have Mr. Barry here. He could maybe shine some light on the situation of the unit next door. I mean, we just have no idea what,
Well, my question is,
what they're experiencing.
did the homeowners association for that neighborhood, did they help out with anything like that if that comes up? I mean, that's something.
That's a really good question.
I mean,
These are the kinds of questions I
Yes.
had also for.
Right.
yeah, because I mean, really, if that's an ongoing issue that they might be dealing with in the future, then they might want to incorporate that into their, HOA funds. I'm just throwing it out there.
It's probably been 10 or 12 years ago. We had several
You
homes,
did.
standalone homes.
Mm-hmm.
And the health department played a large role in getting that all cleaned up.
Were they occupied though? Or
No,
no?
No,
would
They were
not be.
unoccupied? Oh.
They were unoccupied. But, as far as getting dumpsters there, I don't know that our people did the actual work, but we were very
Funded the
instrumental.
remediation.
Right.
I think Kathy, you're right. I remember a couple instances where we have helped to fund something like the dumpster cost
Right.
or things like that. I don't remember ever funding an entire remediation. We did. I think we did some really good work with a failing septic system for somebody who really could not afford to repair it on their own. Those get very expensive. But those were generally situations, if I remember correct, maybe we're thinking about the same ones where the owner was removed, maybe had to be hospitalized or something, and then the family could get in there and help clean it up, and perhaps the owner was going back, and so we could help expedite that with some funds to, for those bigger ticket things like the dumpster and such, but I'd have to go back and look and maybe talk to Dave.
Dave, we all.
Well, you said David is an expert of these sort of scenarios. when we were talking
He has dealt with a lot of these.
Oh, yeah.
Yeah,
And more before I was in.
right,
Yeah, he's seen a couple.
Yeah.
right.
Smelled a couple.
Because this is expensive. I mean, debris
Very.
removal, remediation, disinfection, cleaning,
I mean,
notarizing.
down to where they want keys placed and
Yeah.
pictures placed. It was very specific.
Yeah,
Yeah.
that's a,
I mean, I
seems
guess
like a
those
lot.
companies have to be able to,
Right.
to get into people's
yeah.
personal belongings, so somebody wants them, and I understand.
Yeah, I think first we should come up with some guidelines and then
Well,
pass them before us, and then we can actually.
I think so
address
too,
those
and
things, then-
and that's the thing I was like, Carrie, they have made those guidelines. I think it would be helpful to have them brought to us. We can vote those forward.
Yes.
Also, another question: at what point will you bring them up to us? Like, if someone's asking for help with lab work for $500, what is your threshold before we have to? We should maybe figure that out.
That's a good
What
question.
would we like that threshold to be? Would we like it to be 500? Would we like it to be 1,000 before it comes to a board approval? Otherwise, at the discretion of the staff of the health department. Those types of.
Those are good questions.
Those are really good questions, because we do have instances where somebody is in need of a birth certificate for themselves.
Yeah, and that would be fine.
And,
Right.
We don't.
follow the criteria and put it through, and it's $10.
Sure,
And so
yeah.
I apologize, it's really nothing that I ever, or, a $20.
I don't think it
admin
should.
fee.
I don't think it
That kind
should,
of
but
thing.
I'd like to protect you to have that all covered, as to at what point do you, come to us for approval. So maybe we table this until they can present to us, and then we can also review, I forget what you call it, SOP?
Criteria?
Yeah, the criteria.
Yeah.
In terms of how we use our hardship funding.
Yeah. Do we need to move to table or do you table?
I don't know, do we need to move to table?
You should move
Yes.
the table.
Yes.
Yes.
Yeah. Okay, all right. I move to table the discussion on the hardship request form from the town of Porter.
I'll second that.
Dr. Watson?
Yes.
Dr. Brunt?
Yes.
Dr. Fleming?
Yes.
Robin?
Yes.
Kathy?
Yes.
And Terry?
Yes.
Thank you so much.
Thank you. So we move to old business. One thing I just wanted to bring up, because I forgot to in the beginning, I hope you guys like how they created the agenda for us. We had discussed creating the link so it's easier to bring up those proposals. I think in a perfect world going forward, when we present these agendas online, we can have it that way for the public too, for the things that are appropriate to put out forward in advance. But I very much appreciate your efforts.
That way.
Yeah, yeah. So I very much, I wanted to bring that to everyone's attention, the hard work that you guys put into doing that and how much I appreciate that for us. Any other old business? Report of board attorney. Oh, you got a whole packet.
No, these are the other agenda items. A lot of what I was going to discuss was locked up in the other items we just discussed, including the environmental issue. We looked into basically an outline of what a hardship fund would look like already. Made some suggestions with regard to criterion that would be useful for making sure that it's not a regular occurrence and it doesn't specifically obligate us to any specific amount, and that we can make a contribution that makes sense and maximize the possibility that we could get some money back, or that we're sharing and splitting those costs, so that we're not in the business of this. Because in all likelihood, if you have one, you're going to have, and that you put money towards it, you're going to have 25 over
Right.
some period of time.
My concern.
And looking at that was what and coming up with what a hardship fund would look like was that, including a low end on what you need to ask for approval upon. We also looked at the likelihood of any kind of foreclosure type of proceeding or lien enforcement actions, realistically, it would be useful to potentially to file them. There are some cases where you have low mortgage amounts or something like that in which you could get some sort of recovery. Actually actively enforcing them or having expectations is a different type of situation. So that was a lot of what we put in this month, was looking at that. There was a hardcore site agreement MOU that or contract that we looked into for the use of the site related to that program. In reviewing that, it was acceptable. We're going to have a bunch of I mentioned this to Linda, and it's not as exciting to everybody else, but there's a good potential that all of our contracts that had any kind of non-solicitation or non-compete agreement may be just to that portion void. This contract also has one of those. I see these every day, and because I do enough of employment law to be able to see these on a regular basis. And if the rule from the Department of Labor goes forward, we could very well have that across the country wiped out. And I give that a small chance of actually happening.
Yes.
But this also includes one in which you wouldn't be allowed to solicit this employee away for a period of time based on the contract. That may not be interesting generally to the Board of Health, but it's interesting to lawyers that work for them.
Appreciate that.
And there's also a Valparaiso Community Schools MOU. Just as a general rule with regard to MOUs, I like structuring them. And Davis discussed this with me, and just as whenever you have an MOU, the point of having an MOU is so you don't have a contract. So don't make the MOU look like a contract. That was the only suggestion that I made to the health department this week related to that contract. Then I called it a contract. With regard to that MOU, don't make it look like a contract. So that's all I had for this month.
Thank you. And again, we appreciate you stepping in so seamlessly and keeping everything going in the right direction. So if we can have a motion to approve our claims and receipts that everyone should have signed.
I'll move to approve those.
I'll second.
Dr. Boston,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Kathy,
Yes.
Terry.
Yes.
Thank you.
Thank you. All right. So reports of committee, staff, and health officer in the order of your choosing.
Go ahead.
All right, so I knew that we had a pretty packed agenda tonight, so I put a lot of things in my report. I did kind of want to highlight some items just to make sure, see if anybody had any questions. First of all, if you have any questions, stop me at any time and ask about any of those things. I did want to point out that, I think it was last week or the week before, we did celebrate Administrative Professionals Day. And this week is Nurses Appreciation Week, so I want to recognize the nurses on our board and in our department.
Yes.
In great appreciation for all that they do. So we'll be we did our big employee appreciation. We had done that. We talked about that last month. And so we've kind of brought the other celebrations down just a little bit just to make sure that we're, but we still want to make sure that we let you guys all know how much we appreciate you, because couldn't do anything without you. So I also wanted to do just some quick health fair updates. Many of you are going to be there. Thank you so much. If you are coming and you wanted a t-shirt and you haven't let me know size, please do so tonight if you can, so that we can get those ordered. And also let us know if you need any posters, flyers for your office or any place else that you can think of, and we can get those to you. I did just want to share, it's not the final version, but a mock-up of when the students arrive at the health fair, they're going to get this map card, and we are going to be giving out 500 backpacks filled with school supplies, so their while supplies last. But in order to get them, It's one per student, and the student has to be present with the card, and we're encouraging them to go and visit different booths. And so these booths will all have stamps where they can stamp, and then they can bring them for their backpack. So we can pass it down, and then they get to pick one of their free choice. So we're kind of encouraging them to visit all the different booths. So I just kind of wanted to share that. I did want to come back and follow back up, and I know it's in my report, but about the public health vending machines that we had talked about last month. So what we have decided to do was order all of the items that we were planning to put into the machine or obtain them. Many of them are free through the state. Package them up as we were going to and distribute them to different locations, and we'll in this way be able to do many locations for distribution. So we are collecting a list of locations, and we would welcome any additional suggestions that anyone has. And then what we thought that we would do is, for certain locations or for all of them, if they're willing to leave a few things outside overnight, then that could be for people who aren't willing to come in and ask for them and things like that. We thought we would start in this manner and then see if we do have barriers to people not getting the things that they need because they are not willing to come up and ask, or are there other ways that we can get the things out there. I know, for example, in front of the Hilltop House, they have a free pantry, and they had a free little pantry, and they've actually built a larger pantry, so things could go in there for overnight or for any time. And it may be such that if we do see a lot of locations where it would be nice to have things out all the time, 24 hours a day, something like that could be instituted instead of the vending machine. So we just wanted to say, that we still see the need. We think this would be a way to meet the need while hearing, everyone's concerns and trying it out. So that was where we landed on that. So I just wanted to update anybody, and if you have any questions, please let me know. Yes.
I have a list of the locations.
I do, and I can pass it down or I can read it off. This was just our.
Need to read it. I'm hoping they're positioned around the county.
Yes, and we really would welcome any ideas in various places around the county too that people have. So we have a couple of ideas, both in Hebron and in Couts, but if anybody has any additional ideas, then.
So are you thinking like the libraries? Or?
Yes,
Okay.
yes. So we've actually made contact with the Porter County Library, so they are supposed to talk about it amongst their board, because same as us, they have to, and the YMCA's and, various churches, New Creations, different shelters and recovery centers, the Goodwills, places like that. So did that cover everything? Maybe even, if there are certain apartment buildings or mobile home parks where they think that those supplies would be helpful and things like that.
Would it be possible to utilize this bus system, for the elderly in providing some of these things because at least, those people are on the bus.
It could potentially
they don't have to
supply on the buses.
go anywhere.
Yeah.
Yeah.
On the bus.
Good idea.
Yeah, good idea.
I'm just saying.
Yeah.
Yeah.
2 birds, 1 stone.
Yeah.
Absolutely. Yeah, keep it coming. If you just think of something during the day and want to shoot an email, that would be awesome. I want to make sure I covered. Last month we discussed the asthma grant and how we had received it. Those monies did come in. So as you see in the report, we are been to the first reading, or the auditors actually have to create the fund. So then they will go to the meeting next week to do the second reading. You have to do 2 readings to create a fund. And then we will go before the council in May I think it's May 28th, at their meeting to appropriate the funds exactly as we discussed. It's for training and materials. We also received today our unofficial immunization grant award. It was an email to let us know how much we would be awarded. So we haven't yet seen the executed grant agreement to sign in which they send our contract. But I did want to let you know that this year was in the amount of $248,852.10, which is quite a bit more than we got last year. And we actually had heard that this funding was going to decrease.
Good.
So
Exciting.
we are very excited about that. Jess did a lot of work on that grant. And then she said, This went pretty fast. I don't know if they even read everything I put in there.
Well done.
So, but they did fund everybody fully. So this is just the preliminary with an additional, was it a set amount on top or a set percentage on top? Was it 20,000? 20,000 on top. So yeah, it was exciting. So we will let you know as that moves forward. I did want to let you know that our mobile unit is getting out and about. So last week and this week, the nurses are in a competition, and they divided into 2 teams, and then Kendra gets to be on both teams because we're also doing car seat safety education and fittings. And they each got to choose a location, contact the location, talk about services, and then they kept it secret. And then they only are able to advertise the Monday and Tuesday before going out on Wednesday. And so there are prizes for whomever gets the most services, most people served, yes, and unique people served. So last week, Team 2 actually was out first at the Town and Country in Valparaiso. Team 1 is going to be out at New Creation tomorrow. We also have made contact with Hilltop, and they're going to send us the schedule for their mobile food pantry and their bookmobile so that we can go out with them as much as possible. Now, I have contacted Mayor Bonta, so I'm kind of waiting to hear back. We're struggling. They contacted a lot of businesses in Portage. They weren't able to find anywhere where they could set up. So we've asked if we can be at City Hall, right there on Central Avenue, to offer services as a place in Portage. But if anybody has any other ideas, of course, we have some ideas of places to go and other locations too, and we will get it out and about. So that's...
I stopped by last Wednesday, and I found it to be pretty exciting. You know, as people are walking into Town and Country, like, hey, do you want a blood pressure screen? And you would be amazed. There was young, old, all of the above. So I think that was brilliant, the location, because there's so much foot traffic as it is. And it was really neat to watch you guys engage with the community.
Yes, Jess was offering carry-out grocery services. Well,
she did that many times. As she was offering blood pressure screens, she would put their groceries away into their cars. So yeah, very amazing.
Up at the dunes.
that is a great idea at the state, yes, and that's the state, so we can, or the national parks.
National Park or State Park.
Thank you.
Yeah.
Yes.
Isn't there a Town and Country Portage?
Yeah, there's a Town and Country in Portage, right?
Portage also?
Well, we Portage, we went specifically with Walmart because.
Oh, at Walmart, there, yeah, that area.
They were just like, no.
Myers?
Because they give immunizations, Myers also.
Oh, you're right,
like,
they have their own.
But we
We won't do that, we'll just do this and
Yeah.
not having it.
Can you guys do like Aldi's? I mean, because
No, that's a great idea, we should do that too. I mean,
Yeah.
we're
Yeah,
just
that is a
They're
real,
thinking Goodwill.
the whole
Yeah.
reason
You
for
need
the
foot traffic,
is
in my
for
opinion.
buying.
Right.
oh yeah,
Right.
well I won't go to Aldi's honestly.
So,
I'm always stuck on.
I want it out. Now, I mean,
Go
I guess
further.
one of the hindrances is we don't have a doctor on board with us, so if they
Yeah.
do come and their blood pressure's like nuts,
Yeah.
or you know what I mean, you can tell them they need more in depth, we're looking for that warm handoff, so somebody, which I think is ultimately the point of the whole unit is for to get them into a place that will see them.
They had these little cards that they filled out so that they can take it back to their doctor and show them what their blood pressure was today and information on you know, blood pressure issues and such. So it was really nice.
It was also reassuring to hear the people that were like, I already took mine today.
Yeah.
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 Take it again.
Yeah.
Just self-awareness is
Yeah.
where we're trying to go with people getting better, is being aware of taking a blood pressure.
Yeah.
What is a blood pressure?
Yeah.
Normal blood
No, we
pressure.
had young men who came by. I was very impressed.
Yeah.
You know, good for you. So it was, I liked it. It was enjoyable. Good for you.
It was awesome.
thank you guys so much. So, yeah, they will be out and about tomorrow at New Creations. I think they're gonna do some TB testing, they're gonna offer tetanus shots, do blood pressure screens, the car
Oh,
seats.
they're up
fitting.
ante, team one, huh?
Did you see their Facebook post with the?
I did. I like it.
One other thing I wanted to bring up, community healthcare systems, did I say that right? Powers Health. They have had a proposal that we were going to hear in April, and we were still working on part of the proposal and what the contract would look like. We weren't able to hear their proposal tonight, and they are coming in June to do the proposal. The proposal that they're going to present is for prediabetes and diabetes diagnoses, and it's going to be working with their diabetes educator to also provide some education referral to services if they aren't already seeing a regular doctor, and follow-up care in conjunction with Carrie and Shannon, the diabetes educator for Powers. And I was going to ask if the board would be willing to allow us to do the 30-day notice, how we to post everything for 30 days, beginning tomorrow, so that 30 days, knowing that when we hear the proposal, there may be changes, and we can even note that, or that, of course, it was up to you to vote, so it is something that could not pass, but it is just something that
It's up for proposal.
it's up for proposal, and so we wanted to be able to put that out there for the 30-day proposal, so that if it is something that we pass, we can get started right away working with their diabetes educator out on her mobile unit. And then it's also going to allow her to go out and do these screenings, because that's what she
Which includes
does.
hemoglobin A1C testing, right?
Yes.
Be able to do on
Yes.
spot A1C.
Mhm.
With this funding, that if we do pass it, this proposal that they're making, we will purchase the A1C machine that she'll be able to have, and right then and there be able to have those discussions with patients. Spot on. They've been working on this for a long time, and it's just unfortunately, like, it just hasn't all come to fruition. And we had so many things on the agenda today, and they didn't meet the timeline to get on the agenda today. So it is a pretty exciting proposal. I think it would be beneficial to go ahead and post it, and then we can hash out the details of us if we would want to proceed with it. But
Yeah, the proposal is for the A1C machine and all equipment it would take to run it for a year, and I believe that was like $5,600. And then if we ask Shannon particularly, so let's say that they're going somewhere and we want her to come along with us specifically to our event with the mobile unit, if they're out in a community or wherever, somewhere she wouldn't normally go, then it would be her hourly rate for those hours and our state mileage on top of that. So the total proposal, and they put in a fair amount. I mean, it was a not to exceed for her hours, and I want to say the total, it was under $7,000, I believe, for the whole thing for a calendar year.
And again, it's just another avenue for us to hit these core measures, in a different way. Like we have the Portage YMCA, this is a different avenue to get diabetic education information, and new. And I think it's kind of exciting to have all these little things that we'll have, and we could reassess and see which ones we liked, and and which ones we could move forward with, which one worked well, and so.
And the machines stay with us.
It would actually stay with her.
So
we wouldn't
we
buy
would pay for the machine that would go with her to different counties?
No, so her outreach is, and what her outreach is solely in Porter County. She does a little bit in Hobart, but most of their outreach is done in Porter County.
Outreach program,
Oh.
kind of like how we do at the Portage Y, we're assisting them with the outreach program. So this will help, she can come to our individual events if we ask her to, but this will help her. She goes out into the community and will help to give her more access and more information and more intervention for patients.
More people to.
Yeah,
see.
and more information, to have this A1C
Referrals.
testing, because that's it's so hard to address diabetes without having the A1C.
Yes.
People, because they'll diet that morning, they won't eat anything, and you'll do their fasting blood sugar that morning, and it's perfect, and then you get an A1C and it's 13, so.
It's the policeman of diabetes.
It is, it kind of.
They can tell you what they want to tell you.
Yeah, I mean, I see where you're coming with that.
Yeah. I mean, we all do it. I always behave right before my blood work the night before.
Yeah.
Human nature.
I had an 88-year-old for 15 years take care of his diabetes. His wife passed. He's on oxygen. I was telling him about we need to start organizing a little further work up into X and Y. And he said, Doc, I'm good. I'm done. And I go, well, your A1C still good? We got a lot going. He goes, okay, so let me tell you. Every 6 months when I see you, a month before I see you, I stop my ice cream. I start eating right. And then I realized, I think I do that too.
Yeah.
But it just gives you that guide, make sure.
Too loud.
Let's not
give anybody else ideas like this.
It needs.
I'm from the.
It's like flossing 2 weeks before you go to the
100%.
dentist, so your gums don't bleed.
Great
right?
analogy. Yes.
You know, might happen.
So I do want to give you guys, I'm sorry, completely accurate information. So for the machine and the supplies, and part of the back and forth was just that they thought that the machine would stay with us as well, except unless she was going out with us. So part of our back and forth was increasing the supplies. No, she's out there and she's doing this work in the community. So the machine and the supplies for a year, a travel case to protect it, things like that, that was $59.54. And then it's her hourly rate and mileage not to exceed 40 hours in the year, because we figured, and there will be times where if we don't get to her soon enough, she may only be able to come out for an hour or 2 hours, and we feel that will be more than enough.
Okay.
Very good.
And she will be here next month.
Yes. Okay. Fingers crossed.
1,006.
Do we need to move to post?
vote on whether we can post it?
I will propose a motion to post the Powers Health System diabetic screening proposal.
I'll second.
Till next month.
Till next month.
Dr. Watson?
Yes.
Dr. Brunk?
Yes.
Dr. Fleming?
Yes.
Robin?
Yes.
Kathy?
Yes.
Terry?
Yes.
Thank you.
Thank you.
The next thing I wanted to bring up, and Colby was talking, Attorney Marcus was talking about this earlier when he was talking about the non-compete clause in the contract that we reviewed for a location. What that is about is that we have been chosen as an AmeriCorps HeartCorps site at our health department. So it was actually for rural communities, but Jess's proposal to them, they said, was so great that they started looking into Porter County, because by square mile, we don't qualify for being rural. However, they went looking and said, oh, you guys have some pretty rural areas. And they were so impressed by the proposal that they called and talked with us. And I believe we have been approved as a site. So
Very good.
What that means is I think they consider them volunteers and they give them a per diem, a stipend. So they pay for them and they do all of the training. And then depending on what kind of site we want to be is the services that the HeartCorps individual provides. And Crystal and Jess actually met with them today, and there are lots of options, but one of the things that we had talked about was a BP hub where they would go out into various areas all over the county to hold these BP hubs. And it would be like a weekly rotating basis. So they might be in one place every Monday, one place every Tuesday, or we can choose, if we think it works best for it to be one location for people to come, and so they're trained to do these blood pressures and do education and things like that. The neat thing about this program is it also works in conjunction with things like the Purdue Extension programs that we're talking about, the things that we've approved at the Portage Y, and they will actually work with them as well with assistance for equipment and things like that for the programs that they're offering.
Very exciting.
So it is very exciting. I had mentioned before too that were meeting with Northwest Health regarding save stations, so AED save stations. And as a part of that meeting, we've been talking about being a heart-safe county. And I don't know if you guys are familiar, but LaPorte County became the first county in the state of Indiana to get this designation 3 weeks ago. And Northwest Health LaPorte was the hospital group. You have to have a hospital group that is kind of like the cornerstone of that, I guess, if you'll say. And so, as you can imagine, there's a little bit of competition.
I support.
And so, in our meeting about the save stations, we dove into this meeting about becoming a heart-safe county, heart-safe Porter County, and that is something that we are hoping to form a team around. Of course, it will be led by Northwest Health. And the American Heart Association for, AmeriCorps, HeartCorps, they're also very interested. It's a team that you have to build. So that's very exciting.
Good job.
And that will start, and they'll start soliciting for someone and training them, and then that will come in the fall. And apparently we are not allowed to steal them away as of right now. Contract to work for us for a certain amount of time. So.
My apologies for ruining that surprise.
No, it's
Go
not.
after you.
They make the agenda.
I was like, do I go out of order so that they know? And so it can be full-time or part-time, and it will be based on whomever they find that meets our needs. Jess, did you have anything to add to that?
You covered it. You got it.
And so, yes, there are so many opportunities, and we're just trying to dive into all of them and see who fits, for each one. So we have a new public health intern that's coming for the summer, and she will start the week of May the 20th. Her name is Hannah Fields, and she goes to DePaul University, and she's going to go on to grad school for global health. She had approached us and been interested in interning last year. We already had a commitment to a Master's of Public Health student, so she interned at HealthLink, and she had a great experience there, and she just really still wanted to work for her local health department. She's from Valparaiso, Indiana, and so she will be coming to work with us, and we are very excited about that. She will mostly, I would say, be working with Carrie on Find Help, getting in contact with people, adding people's services, getting people to claim those pages, getting that updated. It is a huge undertaking.
Yeah.
I think way larger than we realized in the beginning. Another thing that we want to start right away is contacting providers and finding out exactly who's accepting new patients, kind of what insurance is taken, so that we have that big picture. Because like Jess was talking about with the mobile unit, that is one of the concerns. If they identify something and somebody does not have a primary care physician, they want to be able to refer. And so we really want to have this big, robust referral list so that we know who would be accepting new patients, kind of what the wait time would be and what insurances might be accepted or who takes what, Medicare, Medicaid, that kind of thing. So that is something that she's going to dive into getting together for us. And one thing that came out of tonight's meeting is also figuring out how can we get information to providers about not only the projects that we're involved in, the programming we're starting or partnering with, but everything that's going on out there. And so I think that might be a good thing for her to ask. Like, how do you get this information? How can we best communicate with you? Those kinds of things. And so that, along with starting to promote Carrie, because we're getting to the point where we're going to need to start doing that. So as she can get some of these things, then we would love the intern to be able to make, if it's a RAC card or something, to introduce Carrie and the services that we're offering through care coordination, get that information out there as well. So those are some of the things that we're thinking about for that. And then the other thing I wanted to mention was a conversation, and it's also in my report, that we've recently had with Valparaiso University is starting a new Master's of Social Work program, and they already have a Master's of Clinical Mental Health Counseling program. So we've been in contact with the heads of those two programs as far as planning a meeting where we can talk about ways that we might be able to coordinate students, and this would not be until at least the spring of 2025, but rotating through our department to provide peer support. So kind of what we're thinking would be in between, when we've identified, and particularly, but not solely, adolescents who are in need of getting in for services, mental health services or counseling services, but there's the wait list. So maybe this would be like a peer support thing in between those things, so that in between time, somebody for them to talk to. And then if it needs to help through Carrie and the care coordination to actually get the appointment and get connected to that care, then that would be something that we would be able to do too, as a whole continuum of care. On that same line, one of our foods inspectors has a bachelor's degree in addictions counseling. And so we've been in conversations with him. He is not licensed because he has been working for us, and he hopes right now to remain working here. But he loves public health, and he actually loves also what he did in school and the thought of being able to get involved in that. And so I think right now, as a peer recovery coach, we're going to look into him being able to be certified as a peer recovery coach, and then maybe we can plug in that way too. And we have a lot to find out. This is all very new and has just recently come about, but I just kind of wanted to keep you in the loop about all of that going on. We also had a job description for a school liaison, and we had written that as a school liaison nurse. as we've gotten into our relationship with the Ask initiative, the task force with PATH and HUB and the Tobacco Coalition, we've kind of started to think our schools have a great relationship with our nursing program, and that actually came through COVID with their connection with Jess, and that's their go-to, their call. They know exactly how to get hooked into clinical services. So we're kind of discussing the possibility of tweaking that job description so it could either be a nurse or a teacher or a social worker, thinking that, you know, curriculum background, social work background, those kinds of things could really service that whole initiative that we're talking about and the whole wraparound of services. And so as we tweak that, we most likely, maybe at the next board meeting, we'll bring a new job description. It won't change anything else, just kind of a job description to look at and see if that would be acceptable to change the job description in that manner. And that was a lot. Does anybody have any questions?
That's a lot of amazing stuff. And again, to highlight like all these community partnerships, when we, you know, discuss things with the state and how we use our funding and the planning that we should be doing as a county, they just keep talking about community partnerships and look at all these different groupings that, you know, you guys have reached out to and made these connections to. I think it's amazing.
It's a lot.
It is a lot. You've done a lot.
Great team.
Very good. Very good. Any other?
I don't want to make this meeting any longer for you all, but I'd like to stay. I'm still. It's still my pleasure to be here with you, and we have not had any real interest in what we've posted as far as the health officer job description as such. And this past month, we expanded a little bit our reach, got in touch with the Indiana Academy of Family Physicians. They have kind of a job board placed out there, and we were talking, there was somewhere else the state.
The
State Department of Health has the job board. It's a little bit cumbersome. I don't know if anybody's tried to look on it. You have to actually log into your Indiana account and all that kind of stuff to even access it. So, but that is out there, and we were just talking about other ways we might be able to work with the hospital systems to maybe get the word out a little bit. So I'll be looking into that too. But until then, it really is been kind of wonderful to be able to be here to see what the amazing things that these people are doing with our HFI funding, and just even on their own initiative is really great. So,
thank you.
Yeah.
Well, thanks for sticking in.
Yes.
Yeah.
We appreciate it.
100%. Yes. Okay. Any miscellaneous? Public comment? God bless you. So motion to adjourn.
Move we adjourn.
I second.
Thank you.
Thank you. All that work on your time. Public comment.